Good evening, everyone, and welcome to the January 16th edition of Beyond the Data. And tonight we have a little bit different episode today. We're going to be talking about in-home healthcare services for, some of our most vulnerable and how some of this has changed since COVID came on the scene. It was already troubled before we ever got to this point, but just talking to these ladies, and actually we have a third person here too, but she got disconnected, and I'm hoping she'll come back pretty soon. But things have gotten even crazier since COVID, and I think the basic story of tonight is, where did all the money go? Because it's not going to the people who need it most. So without further ado, I'm just going to hand it over to Carrie, because Carrie, as many of you who have been watching for a long time have known, she's been dealing with some of these issues with in-home care services for her husband. And so she's gotten to know a lot of these other individuals and how they've struggled in this system, and especially since COVID, what has happened. So Carrie, if you want to introduce one of us.
Sure, absolutely. So, Catherine, first, before we start, I wanted to point out Tim Ranson has a comment. If you could just.
Oh, here, sure. No, he's scared of me.
Yeah, if he is, good, because I think that this is something that he needs to hear. Obviously, home health care and care for our most vulnerable is very near and dear to my heart. There's Janemarie, yay! It is real close to my heart for obvious reasons, as most of you know, so I'm not going to go into that. But earlier this weekend, I received a message from another Ohioan that just said, hey, does Chip have home health care yet? Does he have in-home services? Because she had met with or had questioned one of the constituents for an office and asked what they were going to do for getting services provided to people. And the response was, they have services. Everybody has services. There was only a break long enough for everybody to get a vaccine, and now everybody's got services and everything's hunky-dory. And so
sorry to interrupt there, Carrie. For those who have not been following your story, do you think you want to very briefly go over the last time Chip received services and what you've been receiving since?
So, and I wish Amanda was able to come on, because she's in a unique position. She was one of our providers as well, and still is. So Chip was diagnosed with ALS and FTD prior to being 60 years old. So in Ohio, we have a few different levels of waivers. Obviously, he was not of age for the aging one, but he has the dementia diagnosis, and he kind of fell into a crack. And then somebody, for me, probably having, I don't know, a minor breakdown or something on the phone, somebody said, well, hey, wait a minute, Ohio has the second highest level of ALS cases. They get additional federal funding. So there's actually like a sub waiver of a waiver specifically for them, and it's not based on income. It is based on diagnosis, which of course is ALS, and ALS is terminal. So I filled out the wrong papers the first time, which was fantastic, because I don't know, I've only done that for other patients of mine previously for years, and here I filled out the wrong papers for my own husband. Once it all got straightened out, he was put on the program, everything was fine, and the pandemic hit. March 9th, which was his birthday, was the last time that we were able to have in-home nursing care. The aide would be able to come. We had actually signed up my daughter. She's an independent aide. Obviously, a spouse can't get paid, and it was like that before the pandemic, so no big deal. And then the aides for a while, unless they lived in the home under the ALS waiver, they were not allowed to come into the home at all. So, and then when they started back up, there was this thing called Appendix K, which is a double-edged sword. It hasn't been helpful to us at all. But that allows you to have things like palliative care virtually. And again, and like I said, I still haven't figured out how that you bathe the patient virtually. Like I'm not there yet. I can't get it. I begged for respiratory services, for his needs for his, it was BiPAP ST, and then Bent for, I can't tell you how long. I actually had to go to the media thanks to Twitter and Facebook. Somebody in the media picked it up, and it was still an issue. So I have not had nursing care since March 11th, 2020.
And so they said, though, that there's been no disruption in your service, and everybody in the state of Ohio has had in-home care services.
Right.
This whole time.
This whole time, yeah.
This whole time.
And I knew that there was a lot of people going without. Some of it was because of PPE. So, there was a whole array of issues of why that was happening. So we actually started what's called Chip's Closet, or Chip Shop. And that provides loaner equipment, or if it's disposable, it provides, based on donations to any Ohioan, free of charge, because if, as I told these guys earlier, if we can just do one thing to make it a little bit easier for that moment, then I feel like that is our way of giving back, because people have been so gracious to us. And I'm in a fortunate position to where I do have a lot of friends and family, but not everybody has that. And I recognize that. So after I received that message, then I had hopped on Facebook briefly, and the first post I seen, it went from Alicia's post, and then it immediately went to Janemarie's. And Janemarie has a daughter that does have vent care, and this post read, "This is her daughter," and I swore I wasn't going to cry, so I'm not going to do that. But this post read that she had contacted for transportation. Obviously, her daughter needs assistance being transported. And they had responded to her, the state of Ohio, had she contacted Make-A-Wish Foundation for transportation. And
she was trying to go to the doctor for a normal doctor visit, right, Janemarie? She needed to go see her provider for a normal healthcare visit, and the state of Ohio came to you and said, "Did you ask Make-A-Wish Foundation yet for your needed doctor's visit?"
Yeah, that's correct. And since 2017, we have been going round and round with the state of Ohio as far as ambulance transportation.
So
when did they ask you about the Make-A-Wish Foundation thing? Was that earlier or more recent?
That was an email just the other day. We've actually had multiple care conferences via web platforms the last couple months regarding transportation issues. I sent them a bill at the end in September, I believe it was. I sat down and did categorized all of her transportations for 2020 and went to their own as far as what they would pay an ambulance company to transport her to and from her doctor's appointments. And I sent that to them, and this is for 2020, and it was almost $10,000.
And you paid that out of pocket?
Well, I do the transportation myself, so I mean, my cost isn't that much, but I still have to maintain a vehicle that is safe for her to ride in. Which means, tires, repairs, general maintenance. I had to pay out of pocket for an ambulance cot so she could be safely transported. Yeah.
So, and how did you get your ambulance cot?
I bought it off of Gov Deals. Came from a fire department outside of Charlotte, North Carolina. I had to go down and get it.
So, Janemarie, like I said, these two, wow, what advocates, but at the same time, a strong voice, but they've just been put through it, left and right and up and down. And we're not hearing these stories in Ohio. So, Janemarie, how many hours of care is your daughter set to have for nursing care?
She's 24-hour care. Since she's on the Ohio Home Care Waiver Program, they have a maximum allotment, which is 112 hours a week, which is what she is authorized of private duty nursing care.
Okay, and how many hours is she getting?
39.
And who provides the rest of those hours?
I do.
How many days do you go without sleep?
4.5.
Are you able to maintain employment outside of the home?
No.
What did you do for employment prior to this? And you do not have to disclose.
I worked in public safety. I ran medic for 10 years and I was a police officer for almost 5.
Okay, so you worked supporting the public and helping the public. Probably saw a lot of people in their darkest hour.
Yeah. And I paid into this system.
Right.
And it's failed us. It's failed my daughter. It's failed myself. Yeah.
Were you being underserved before COVID hit, or did it just become more intense now, or?
We were underserved before COVID hit. Yes. For us, it started in July of 2016. My daughter had a nurse for 10 years, and the state of Ohio, through their CareStar, one of their case management agencies, pulled my daughter's nurse, said she was no longer allowed to provide services to her because the nurse and her husband owned the home we live in. By all rules and regulations, federal and state, we fit into the category of living in a provider-owned or controlled residence. We were not violating state law. We were not violating federal law. We were well within the regulations. And I was told, yeah, not you. It took 18, it started because I was trying to get a wheelchair ramp for my daughter, which ended up taking 18 months to get, and losing her nurse in the process. When she lost her nurse in 2016, I did all of my daughter's care 24 hours a day, 7 days a week for about 2 years.
So do you feel that the pandemic has amplified the situation with care?
Oh, absolutely. It's made things worse. The providers are not out there that used to be out there. I don't see a recovery from this.
Alicia, how many hours are you supposed to have for care?
So I'm authorized 58 hours of aid care, and also 6 to 8 hours of that. Aid care is a week, and then 6 to 8 hours of nursing a day. I am not getting any nursing care at all, and I'm only getting 7 hours of care under my waiver. I did go 2 months recently that I didn't have any care under my waiver at all. And my church, it's an hour from my home, is providing a lot of assistance. But I'm pretty much on my own. I've been bullied and harassed by my managed care plan about an institution, and also other things. And it's truly been a heartache.
So it's a lot easier to institutionalize, which we have found that, with my husband as well. It's a lot easier for any program, regardless if it's income based or if it's not, if it's need based or diagnosis based, to put them in a care home versus keeping them home, even though it's cheaper and more affordable to keep them at home.
It's cost
So
1/6 of the cost to live in the community than it does in nursing home. Ohio is paying for 22,000 unused nursing home beds. They still continue to pay for that in the budget bill that was passed this year. But also, there's something called Olmstead Rights, which is every person with a disability has, and that's the right to live in the community with the necessary supports possible. But Ohio creates so many hoops to accessing care that make it so we can't even obtain workers. And I personally have spent hours just emailing the Medicaid director, advocating. I've created art, written articles, about some of the challenges in Ohio because there's all these different systems and it's very complex. Everybody's on a different waiver service, but they don't make provider enrollment easy. You can ask lots of questions and just get no answers. There's like several ADA violations by the state to just like provider enrollment alone. And the contracting, I'm on a managed care plan, and the problems I have on my current managed care plan, I had on 2 other managed care plans. It's like the state of Ohio, they know that when they allow the managed care plans to take, more than 6 months or to contract a worker, that they're allowing these managed care plans to commit fraud on the state's part because the managed care plans get paid extra money and capitation payments to people on home and community-based waivers. And so, all while, like, I have a guy right now who I've been trying to get contracted for 17 months, and he's worked as a Medicaid provider for 15 years. And we're sitting on it, countless emails, and all while I don't have any care. And so it's just been a horrible mess because I've talked to like state senators, I've participated in every advocacy group I can be on, and even had, served on forums and panels with the directors of Medicaid, aging, and developmental disabilities, trying to call these problems out. And they just don't care. Nobody wants to overhaul the system. And, it's at a dire place. I mean, there are thousands of people that just don't have care. But I'm going to keep speaking out, and, yeah, that's all I can do.
So how long has it been since your provider, and I know you're not getting the hours that you're supposed to, but how long has it been since he's been paid?
So my current provider hasn't been paid in 472 days. And I had another provider that I had from October of 2020 to June of 2021, who went several months without pay as well. And she never got paid. I spoke to her like a week ago and learned that they didn't pay her for like the last 6 months of my care.
And we all know that the state of Ohio has gotten CARES Act funding. They've gotten federal money that is specifically directed towards helping people in exactly your situation.
But the problem is that
COVID, and
even with that money that they're getting,
where is it?
They make it impossible for providers to actually obtain the hazard pay that's been offered. They give you these complicated applications, and some providers come back and they don't even they don't even qualify, or they're not approved. And we see it all across the several Facebook groups that I'm in. So many different providers that haven't gotten it, and also if their billing is not up to date or they've not been paid, they also don't qualify for that.
Right.
That reason as well.
And independent providers that are not an LLC, like my daughter, she wouldn't qualify either. So she's able to help and assist with her dad. But because she's an independent provider, but not an LLC, she did not qualify for that. So who knows where that money I don't know, is it sitting there accruing interest? Did it go somewhere? All I know is that it's not going to these patients as it was intended. Our whole point of all of this last 2 years was to protect the most vulnerable. And we have 2 examples of the most vulnerable sitting here that have not been protected. They have been hurt. And it's the most emotional stress I know for myself personally that I have ever been under and experienced. Um, and both of them are due more than an apology for sure. I crunched some numbers, got a hold of a couple people, and then spoke with Alicia prior to. So there's not supposed to be a waiting list for, again, you have multiple waivers. You have one that's a DODD, which is the Department of Developmental Disabilities, and then you have the home based care waiver. And then, like Chip has got a sub waiver under that, and then you have passport. There's all of these different waivers that are out there, with different rules, but there are right now, from our last count, 48,700 Ohioans waiting for services on a waiver or waiting to be placed on a waiver. 48,700 Ohioans. So these stories that you're just hearing are not abnormal. This is not just some fluke. It has continued to happen. And we think when we hear Medicaid, low income, well, yeah, of course, it certainly can be low income, but Office on Aging, they have a waiver too. And, like for our situation, we had too many assets at that time, but he had the diagnosis. For my husband, and I'm sure Janemarie is probably pretty close, on average, it's about $260,000 every year to care for somebody with that diagnosis. So there has to be some support there somewhere. And you do, you take out every 401k, you take out 403b, you do everything that you can, and you provide them, give them the opportunity to be in their least restrictive environment at home. That's all people want. They want to be with their family. I will tell you right now, there is absolutely no way I would put my loved one in a nursing home. Not right now. And I just think that we need to really be aware that this is happening. I know I go, I sleep what's called the third day. So by the third day, that's why I have a brick wall. I hit a wall and I have to have a couple hours sleep, and then I can recharge and go again. And it's hard enough when it's your spouse. Can't imagine it being your child. I certainly can't imagine Alicia's situation where you talk and you talk and you talk and nothing's changing, and nobody's hearing you. And even if there's
I will say with my situation, Carrie, I'm in a program to protect my safety, and I've been bullied, harassed, intimidated, told that I need to choose between my safety and my home care. And it's like they just don't get it. Like, you can have both. They just, but they don't really want both. To do anything that helps you improve your life or your well-being. And it's so frustrating. Like, like they make the enrollment process to become a provider so complicated too. And it's like, you don't know from day to day, like what you're going to do. And they make it so families are living on one income, and they force parents to be natural supports, free natural supports, even though there's ways that they can work, for the person. But it's just like, it's heartbreaking what's happening in Ohio, and anyone that says we're getting the care we need, we're not.
Right. So now I will say that with Appendix K, they did, and I just had this situation come up with somebody else, and I think I'd actually shared the article that one of you had posted. Another state is really looking into the sexual assault in home care and nursing home care. And there was a situation here in Ohio with the Appendix K and being able to be a paid provider, and those that need it can't get a hold of that. It's very difficult, like Janemarie. And they had waived a couple of the requirements during the pandemic, and home care provider actually assaulted someone, another Ohioan. So I'm struggling with protect the most vulnerable, because I'm not seeing that happen. We're not doing it in the nursing homes for sure. Not that the workers aren't trying, because I feel that they are. It's just the system sets that staff up to fail. And definitely not at home. I know it takes everything I have. I'm sure Janemarie, it takes everything she has. And Alicia, several times, she's like, I'm fighting for this, I'm fighting for that. We have had all this influx of money that are supposed to be going towards these programs. Alicia should
They didn't
not
even
be.
pay for PPE. They were supposed to fund PPE, and Medicaid cut the amount of PPE you could get. I mean, I'm on a limited income, and I paid for my provider's PPE because when the pandemic hit, before the pandemic hit, I had to wear masks because of another condition I have, and they took away the ability to access masks. They took away gloves. They took away like anything that was PPE. Like I had to like fight to even get IV infusion supplies at one point
Yeah,
because they weren't giving it to people on home care waivers. And we
right.
saw a lot of that in a Facebook group that I run, where people couldn't get access to gloves or gowns or other PPE that they needed. And they supposedly gave a bunch to the different area on aging organizations, but no one really ever saw that. Like we
No.
called them out on it in the Cleveland area, Akron area. No one really ever saw that PPE. We don't know what happened to it. It was like supposed to be like 13 pallets or something.
Yeah, and we have no clue. And the same with my county too. They have no idea where it went. And so what had happened was, I think somebody had posted, maybe Alicia had posted that we're supposed to be getting these pallets of PPE. So that means they should be divided out. Nobody knew at our local area where they were going, but they knew they were supposed to be coming, and it was quite a large amount of money. And then we started seeing, people were getting hold of Chip's page. We do have a page for Chip. It's called Keeping Up with Chip. And they were like, they're only sending me 15 gloves for 30 days, not 15 pairs, 15 gloves for 30 days. And I'm like, that doesn't work. Like, you can't take care of someone like that. So we started doing our own for gloves and sending gloves to people, and they were so fortunate and so grateful just to have a box of gloves. And that's one thing about anybody that is in home care, or has a loved one that needs it. Wow, we definitely know how to MacGyver and utilize and stretch things, so it makes me feel good to know that we're able to do that, but it still doesn't fix the problem. And as a governor, as a senator, as a state representative, you should be embarrassed. You should be embarrassed that you have constituents that are going through these things, and they're private
I would like to
citizens.
say something about this,
help.
actually. I was on a forum for the Olmstead Task Force direct support group. There were 5 virtual ones that happened around the state, and we talked about the problems, but we tried to sit down with different state senators and representatives, and it seemed like they really weren't interested in hearing about things. And the one big thing is there was this surety bond measure that was put into the Ohio budget bill that will make it even harder for us to recruit workers, because our providers will need to get surety bonds and a licensure through the Ohio Department of Health. And so basically, when we sat down with one of the senators, he acted like he didn't know anything about it. And it's just been completely frustrating, sitting down with different senators and different representatives, and they don't know about something that they signed, into
Right.
law. And the other thing is that the state of Ohio has made the legislative and policy making process not accessible. So like Medicaid will hold stakeholder meetings on like budget. For example, there was one on all this CARES Act funding. It was not ADA accessible. When we called them out, they were just like, it doesn't matter, our platform doesn't support it. And so basically they're just excluding people with disabilities from the legislative policy making process and passing things and not making it so there's equal access to fair input.
Well, and it's not only against. I mean, unfortunately, through all of this horrible experience over the last couple of years, I've also gone down to the state house, and even for able-bodied people, they make it crazy. I mean, it just you cannot have a life or a job or responsibilities and be able to engage in the legislative process. It's absolutely insane the barriers they put up. They will literally on a moment's notice suddenly put bills out there that are sweeping, massive sweeping bills with absolutely no time to read it. And this is, we're throwing it through committee. We'll have everybody, talk about it and you don't even know about it. It's the system down in Columbus is so far corrupt. I couldn't believe it. I really can't believe how corrupt.
I have a question.
Well, it was the Ohio Home Care and Hospice that lobbied for the surety bonds. And it was really interesting because I'm on an advocacy group and we tried to call it out for what it was. And they were angry because we had a lot of questions. Our advocacy groups did, why didn't we take our input,
Yeah, they can get glad in the same pants they got mad in. That's fine. But that's just, they're just going to have to get over it. But I have a question for both of you. Do either of you know how much money Ohio received and delegated to these programs from CARES funding or any COVID relief funding?
It was like 500 million, I believe. It could have been a little more than that. I don't have the exact statistics. I could probably give them to someone after the show.
Okay, so it wasn't like 500,000.
No. They got a lot of money, but they also got two different pots of money. They got the original CARES Act funding, but then they also got ARPA funding as well.
Okay. And do we know, other than the invisible PPE pallets, do we know where this money went?
Carrie, some of the money went to the counties to provide rental assistance, utility assistance, help through places like okay, so I live in Montgomery County, so that place that CARES Act funding went to for us to do those specific things was Community Action Partnership. And then you had to apply online to get help them pay your mortgage, pay your rent with utilities, things like that.
So but for Medicaid,
well, Medicaid also spent a lot of money giving gift cards for getting people the vaccine all over the state. So there was a huge a huge amount of money that went to giving people gift cards if you got your COVID shots or your kids got them. I don't know how much money, but I don't know if any of that took away from home and community funding or not. But
the gift cards were, each gift card was for $100.
Okay. How many gift cards were there? I mean, if you're going to be a corrupt system, you have gift cards, and well, how do you know if it's actually going to somebody who's even taking the vaccine, or maybe they get a few of them? I mean, I'm at this point. Where'd the money go?
Right, and I guess unemployment is a perfect example. I mean, look at how horrible, I mean, seriously. So how do we know where it went? But, when I look at, I don't care. I do not care if it directly took away from home care, because it surely did not contribute to home care where it could have been utilized. And I'm sorry, as we are, yay, go get vaccinated or whatever.
Well, they supposedly also created a new credentialing system that they've been touting about as well, that was supposed to make it where all the systems could apply in one place. But there's a little known thing that people don't realize is that that's not going to help managed care contracting, because you still have to go to each of the managed care plans to get a contract. So it won't solve any of the enrollment problems.
Yeah, Brandy just had a really good question. Did they use that money for the Vax-A-Million lottery? I don't know, but all I know is that if everybody got $100 or whatever, and I didn't even know about that thing, but I just know that we, three of us, as well as another 48,600 and 97, because there's 3 of us sitting here, people are, Ohioans are waiting for some type of service on a program, or without a program, that $100, I don't know what kind of gift card it was, Applebee's, Burger King, whatever, surely could have been utilized in better places.
Oh, absolutely.
You know, that's, or, you know, $100 worth of PPE would be freaking fantastic for some people. Or I don't know, Alicia, maybe she can get a freaking bed rail.
Yeah. Oh, yeah.
Yeah,
That was
actually,
one thing that was discussed before as well.
These programs are so bad that for like 5 months, I slept between my wheelchair and the floor because my managed care plan jerked me around about a hospital bed. And then I had to resort to social media to get people to help me get a bed. And now I'm fighting over a bed rail that they won't provide me. And I'm supposed to be getting other things like wipes and, you know, because I can't shower. I shower like once a week, you know, because that's the only time I can get care. And so, you know, they are supposed to provide things, but every time it's just countless emails that go over and over again. I mean, and you don't ever really get anywhere. It's just, no, but they just keep stalling on everything. Like, even like, you know, incontinence supplies and other things that, you know, I need for my care. I mean, I have to use a suction machine. And I had to pay out of pocket for it. You know, I have to pay for all the supplies because my doctor can order countless things, and it's literally like they don't want to pay for anything. So you get to the place where you have to pay for it yourself or go to a charity or something like that because it's
or you go without.
So many problems in Ohio.
Yeah.
And from COVID money, just from COVID money, there's an extra $500 million.
Yes. Yeah. But they didn't hesitate to send me a body bag for my husband. But Alicia can't get wipes, you know, or maybe somebody in to assist her to take a shower. So I could go on and on about this all night long, but I'm going to ask you both. And Alicia, you can go first because your name starts with A, and I'm looking at you first. If you could name one thing that the pandemic has affected with your care, what would it be and why?
So the one thing that is affected is the access to nursing services, and it's made it so it's made it so that I'm running like an anaphylaxis protocol on my own in my home, where it's something that should be done in a hospital, and I'm having to suction myself in an emergency, and I mean, it's insane what I have to do for myself just to be independent and not have to end up in the hospital every other day. And so, you know, it's that the pandemic has made it so I can't access nursing and, you know, or the appropriate supports. So.
Janemarie.
It's made it harder for us to get providers. They're just not there. And the vaccine mandate doesn't help either. You know, we can't do a lot of the stuff we used to be able to do. I'm not one to stay at home with her. We do pack up. We go to the park. We go to concerts. I've taken her to the beach. You know,
you've lived.
Yeah, exactly. It put a stop to all of that, and not because I was in fear that she was going to catch something, but that because of all the restrictions, we just couldn't do it and go places, and everything shut down. And what kind of a life is that? It felt like we were imprisoned in our own home. And so why, you know, I guess for me, it's like, what good is it to be alive if you're in prison, even if it is your own home? You know, I would rather live with the risk of anything, and knowing already, because I've been through this, my daughter's 16 and a half now, and she had a cardiac arrest at 18 months, and that's why she's the way she is. So I've almost lost her. So I'm not afraid of her to catch any type of a virus or anything like that. I know that I might not have a lot of time with her. So the time we do have is very precious. And, however much time she has left on this earth, she deserves to spend it having fun and doing the things she loves and enjoys and doing all of that stuff. Not being imprisoned at home, stuck at home, staring at walls and watching TV.
Or
I
being
mean, that's just,
institutionalized.
yeah, I will never put her in an institution. That is one thing I have made very, very clear to everybody, including Medicaid. And when I had my spinal surgery, they tried to get me to put her in an institution because the nursing agency that we had at that time walked out with no notice. And for 2 days after a cervical fusion, I provided 24-hour care to my daughter. Medicaid stepped in and pulled her and had her taken to the hospital, which I will not fault them for that. That was, I couldn't do it anymore. But I didn't see the repercussions come back on that agency for anything that they did wrong.
Like patient
that would have
abandonment.
came back. Yeah, that should have, or that
Right.
would have came back on an independent provider.
Oh yeah. Oh yeah.
I mean, it was, yeah, there's a double standard there between agencies and independent providers. Whereas you have PCG that oversees independent providers, PCG does not oversee agencies. Agencies get by with a whole lot of shady stuff and a whole lot of stuff that they, that if it was an IP, ODM would have hung them.
Yeah. So
For-
I would like to say something about that actually. So Ohio has many challenges with their like auditing of Medicaid providers, and it's so like because the enrollment process is so complex when you're trying to recruit workers. All the information is in a bunch of different places, and so someone could be providing care, and then they get to their audit, and they discover that they didn't have one paper or another, or they didn't follow some rule that they didn't know about. Then you have to pay back money, and it's ridiculous. Like I had a provider once who I was using a stamped signature thing, and my case manager didn't give me a date signature, so he wrote in the dates for me because I couldn't write, and they tried to make him pay back like 3 months of work where he actually worked all the shifts, and it was simply just because of a paperwork error. So we have a lot of providers that have left working in Ohio because of paperwork errors and extreme auditing practices. And also, too, the other thing is that the electronic visit verification stuff, it's basically tracking devices for the disabled, federal law that said that the government could electronically track people with disabilities. I fought for several years about this on the federal, state, and national level, but a lot of people left when EVV was instituted. We spent $66.8 million on tracking devices for people with disabilities to curb fraud. And so a lot of people left because of that. And
yeah,
so,
that's
and
true. It's
nobody
called
wants
EPP.
to be tracked and everything. And
no,
all of that. I mean, but the Ohio law clearly says that you can use methods that don't track you, but that's not what happens when providers are being trained, because the state makes it so impossible for you to use the alternative methods. That was one of my challenges, and I had a provider that was in her 70s that actually quit because we went round and round for months on end with Medicaid, and all they would do is give me a 300-page manual and say figure it out yourself. And it's like you have to have like a huge education, but they don't think about people that are not tech savvy, or they may be older and they're not. But I'm just saying that the ridiculous hoops that our providers have to jump through, it makes people want to leave or not do this job because of all the things you have to, you have to jump, all the hoops you have to jump through to just provide care for people.
So Tim just had a great question. Do agencies pay lobbyists in Ohio to keep bureaucrats off of them? Absolutely. Absolutely, Tim.
Mhm.
Yes, you are correct. There are several lobbyists that obviously profit. That's what they do for a living. And that's the name of the game, the way it works. So you have, like I said, my daughter is an independent provider. And she's going to get, fortunately, she only provides for her dad. That's it. And that's kind of like her time with him. So we don't mess with that time. And now that, she's going back to school, that's not going to be an option. But that's my, when I hit the wall sleep time, that's her. That's what it's for. But she's going to get hit harder, and she has to make sure all of her I's are dotted and T's are crossed much more than an agency that, has a lobbyist, and they kind of are able to negotiate things better. And the EVV system through Sandata is everything that Alicia said. I can attest to that 100%. It's quite, I won't get into it because we would be here all night, but it's quite a complex tracking system per se. And
it violates our civil rights, and
it is a violation of civil rights.
and
Why?
people like
What are
Renee
they
voted
tracking? What is the argument for tracking you? This is where I'm a little confused on why track.
Okay, so
The
federal law
device
doesn't say
alerts
GPS track.
them where the provider logs in and logs out at. So when they first started with EVV, and they came out with the device, it would automatically alert ODM if the device was more than 1,000 feet away from the client's residence.
Mm-hmm.
Well, the problem with that is this is home and community-based services. My daughter doesn't have to be at home. She's allowed to go out and about in the community.
It's a way to trap you in your home.
And for them to track that is like her wearing an ankle bracelet. She's not on house arrest. She's not confined to her home. So why do they need to know where she's at and where she's getting her services at, or that we're going anywhere? Because she's disabled. She's not a convicted felon.
And there it is. That probably nails it as much as I wanted to this evening.
The thing about it, all of it is that the federal law doesn't actually say GPS track or use biometrics on anyone. And the Center for Medicare and Medicaid Services said in the 2017 stakeholder meeting after the law was passed that a drop-down menu for home or community would meet the requirement of location. I co-founded Stop EVV. As of today, we're not an organization anymore, but and I served on the National Council for Independent Living's EVV Task Force and Steering Committee for 3 years, and trying to repeal this, but it's all these tech companies have banked on invading the privacy of people with disabilities, and so many providers have left because of it. And Ohio's basically refused a fair stakeholder process, and just they've made it so complicated for providers so we've lost so many providers because of it.
Right. And of course,
sorry, go.
The pandemic has only amplified that. So we've already asked that question of, what is one thing that the pandemic has challenged with home care and why. But I have
I will
one more
say it was
question.
bad before the pandemic, though. In 2019,
it's always been bad, yeah.
In 2019, I sat down with State Senator Vernon Sykes in Akron, and he told me to be more organized. I gave him some art pieces that I painted on, about the care crisis. Told me to be more organized after I gave him a list of 79 families with over 10,000 hours of care that didn't have care. He just told me to be more organized. In 2020, I sat on an advocacy panel with the directors of Medicaid, DODD, and aging, where there were thousands of people then that didn't have care. And they just didn't really seem to have anything solution for us or do anything. 2021, I went through a whole year of major crises, and they still don't want to do anything. I mean, it's just their whole thing is use your backup plan, but what do you do when you're 200 and some days on your backup plan?
Right, exactly. And
Mhm.
there's
And now
a
they're
couple
trying to create
questions
laws
here.
to change. They're trying to
Yeah.
create laws. There's a JCAR hearing in January 25th, and they're trying to change the rules so that the consumer is responsible for finding providers now to take it.
Yeah.
So make it so that Medicaid is not accountable to keeping
Right,
up to
and
date provider directories.
that's what it does. So there's a couple questions Eileen asked, but isn't EBB also to make sure that the provider actually shows up? Yes, that was the intent of it, but you do not need an
Mhm.
electronic device to make sure that the provider shows up, because guess what? You can give me your login, and I can log you right on in. I can log you right on out too. Whereas if both are signing a physical signature, or if they can't sign, alternative to that, if both are signing or both are attesting to, yes, that provider was there, that's sufficient. Because again, if you have a situation like Janemarie, she's already said, my daughter isn't a felon. She's disabled, and for as long as she's here and I have with her, I should be able to take her to the park and not have to worry about that nurse that's there assisting, getting paid. Yeah, that just doesn't make any sense to me at all. That's what our progress notes are for. They can cross-reference if that's really an issue, because if they're that much of a stickler, then I want to see them be that much of a stickler with an agency whenever a nurse administers the wrong medication. Now that we have medication aides in nursing homes with zero training because we waived that and they're passing meds, I want the same accountability for that as well, because that's how we maintain accountability. So we've already asked the question of, what has been the one thing that's been more challenging. Yes, this is a broken system prior to, and adding programs to a broken system doesn't fix the broken system. It just muddies the water of a broken system. And that's exactly what we've done, to where now there's no accountability, or it's very difficult to get accountability with these programs. And especially there's a lot of money funneling in, but I promise it's not going to these patients as it should be. But if for each of you, if you could express to the governor one situation with yourself or your loved one that has been made more difficult with the pandemic and how he has handled it, what would you say to him with in-home care and the pandemic? Did we really protect the most vulnerable?
I would like to say that the governor that he has left the disabled community out to dry. He's left us without PPE. He's ignored a severe crisis that, even with letters from the advocacy groups, we've been ignored, and he's allowed fraud to go on around our services, and he should be ashamed of himself. The fact that he's allowed allowed the system to hurt vulnerable people and families, and to just make it so people are either institutionalized or dead, and it's so sad. And so I just think that the governor has really failed the Ohioans with disabilities, and and his lack of response to even Olmstead task force and the other advocacy groups is disgusting, and that and that Ohioans deserve better.
I agree with you 100%. Janemarie.
Am I allowed to comment on Mikey?
Sure.
Him and I have a history.
Well, he said he has no regrets. That was his last statement to the press. He has no regrets with any way that he's handled the last 2 years at all. Cheers.
Wow.
He's done a fantastic job.
Yeah, he feels he's done
He
a fantastic job.
he told Medicaid to please ask me to stop saying I was going to show up on his doorstep with my daughter. So, yeah, because that's exactly what I said I was going to do with the way that things were going with Medicaid and their programs and how they were failing people on them, my daughter and the kids like her. And that the only way to get something done was to show up on his doorstep and make him look her in the face and look at her. And that's how I feel with this state legislature and everybody at Medicaid too. They do not have a clue. They've all failed us. They've failed everybody on this program. This has made it worse. COVID made it worse. And all they cared about was lining their pockets with federal dollars, because it didn't go to us. It didn't go to the families. It didn't go to the people that needed it. And, my daughter's nurse that she had, she didn't see any of it. It never trickled down to her agency and to her.
I'm going to read a statement, and I would just like to get your reaction from it. This is from one of the viewers for both of you. Alicia, why are you already smiling at me? The governor says we are all in this together, yet here are people left out of the discussion.
Yeah, we're not in
I
this
just want
together.
to say that the governor does not include us in conversations. We were not really invited to the table, and for anything in the state, really, we have to force our way in, through our advocacy efforts. And so I don't feel like we're in this together when the governor has not done anything to assist with the provider shortages, or even cared about how complicated it is to enroll a provider. Doesn't even really want to overhaul managed care. The procurement was a huge joke. It had nothing to do with overhauling home care, managed care stuff. I don't feel like we're all in this together, because, how can we be if the governor, people that are, sitting up there with him, in office, don't even care about our services.
Well, the interesting thing about it is, I mean, when I heard some of your stories earlier as well, and through all this, it's just like it just screams to me that this is purely money based, and it is just set up to push you out of your independence. And as you said before, living independently at home is 1/6 the cost of an institutionalized care situation. We've had all this money, 500 million extra dollars that just vanished. I mean, everything to me screams like, okay, somebody is committing fraud, and it looks like they're doing everything in their power to make you suffer, make it impossible for you to get care. Any kind of providers, everything I'm hearing from you is they are putting up block after block after block after block of getting any providers. So yeah, you can have care if you can find it, and then they make it impossible so that
virtually.
Yeah, or it's ridiculous. It's laughable. How do you bathe someone, help somebody bathe someone twice your size virtually?
Right.
And then you charge for it. I mean, it's insane. It's all pushing you towards institutionalization. And then to me, the big question is who is financially benefiting from forcing people who cost less, have better quality of life into an institutional setting, which is far more expensive? I mean, somebody is benefiting from this.
So I'm sure it has something to do with the 22,000 nursing home beds that we're paying for, and that didn't change with the budget bill. I'm pretty sure it has something to do with that. I mean,
That are
also we do
empty.
have a split state of like people that do lobby for institutions as well. But I really think that, there's a lot of nursing homes and other groups that are lining the pockets of our governor. And, and I feel very, sad that, he doesn't really want to support, in the independent living movement at all, and also he doesn't even care about victims' rights, for crime victims. That was something that, I discovered in the last year about this guy. I mean, all I can say is, and, he used to work as the attorney general, but he's allowing the managed care companies to fraud the state of Ohio by ignoring the contracting problems. I mean, it has been a known fact since 2017 that these managed care plans take, it used to be like 3 to 6 months. Now it's me waiting 17 months. I mean, it's, and the thing is, the managed care plans get extra money by the state in capitation payments for people on home and community-based services. So where's that money even going when we're not getting the care? They're just banking it. I mean, I've only had 7 hours of care a week since June. I mean, and it's ridiculous.
And
I can't
she's
even take
at
1
risk
hour a day to take a shower.
Right. And she's at risk to lose that now because he hasn't been paid in over 400 days. So the situation we're in right now is my husband, as you know, was switched at the beginning of the year without us knowing from one waiver to the other. And the book is beautiful and it says it's supposed to be this awesome transition and nothing will be interrupted. The girls go to Bill and boom, denied because you have a managed care plan because he's Medicare and Medicaid. And it was 10 hours on the phone and they're like, well, you have to find, I said, do you realize how rural we live? You don't have anyone that does FTD and ALS. And I was told that this is how that it's supposed to go. And I'll be honest, we have a very good person that we know on a personal level that works at CareStar. So she was able to try and, and she's like, this is a problem that you're telling me it's going to be 45 days before he's even assigned a care manager. So he's without care for 45 days, like nothing, like they don't get paid at all. Nothing. And here I'm hearing that somebody is on 400 days. So I'm not very hopeful for that. And I just saw that, we have so many comments, so what can we do about, I don't know. I don't know what we can do about it, but here's what I'm going to ask each and every person, because I have a feeling that these two, as well as many, many others, as well as providers, they've probably been on this. And I'm just kind of late to the game coming in. But I'm going to ask anybody that can to place a phone call or an email to any senator, state representative, the governor himself, the media, ask them where the money from the CARES and the funding? ARPA funding that was allotted to Medicare waivered and Office on Aging programs, where did it go? Where's the money? And I'm going to tell you right now that if they say it went to you get 4 free freaking tests or whatever it is, I'm probably going to lose my ever loving mind. So I hope they have a better answer than that.
Oh, there's no money for, and I also want to say that there's not home tests that have even been giving, like there's no COVID tests that have been given to home care people, like for COVID as well. So like if they tout about saying that there's been no money given to testing, people are having a hard time accessing testing. Just
our state was given money for rural clinic because we have such a rural percentage. They were given money to take the vaccines out if people called and asked for them, the homebound, if they really wanted it. I don't know of any person that's happened to, that they've been able to access that. We have actually, this state has got a lot of money on top of the other money that they've discussed here this evening, specifically for the pandemic in a rural setting. And I promise you, it's not going to rural patients. I have one. So And somebody says, I've already contacted the governor about my son and never heard anything back. I recently contacted the White House. I think I'm going to contact the White House every day. That's sad because just like Janemarie or Alicia or myself or anybody, yes, we're all on, every day that we live is a day closer to being our last day on earth. I understand that. But when you have these complex medical things, you know you are on borrowed time. And every day is truly a gift. And we appreciate that. And it takes so much out of us and those around us because they can't help and they want to. I can't tell you how many times Catherine's been like, what do you need? And I'm like, I don't even know what I need right now. I have no clue what I'm doing. I'm winging it because we're just so tired and we don't know what we need. We shouldn't have to fight this hard. Like I'm down for a good rumble. I'll fight if I have to in any way, shape, or form, whatever capacity. But this is beyond the human ability to take. So I'm telling you all, Ohioans are struggling.
And there's no need for it. And there's no need for it. The money is there. The providers were there, but now they're being blocked. And everything is just pushing to the nursing homes, which, of course, in terms of COVID, we had that's where most of our deaths occurred. Were in nursing homes.
Sunshine, I'm seeing the message. But I'm seeing if there's another message other than the comments that are here, I don't see that. Catherine would see that. And Bobby says, Carrie, can you post the names for us? CARES Act and the other one, which is the ARPA. Alicia, is it possible when we're done that you can write on this post CARES Act and ARPA? Okay. Just because I know that you're really good at that. So technology, I send to somebody else. And maybe ask for info from our state treasurer. Well, you would think in the checkbook, we would be able to see that. So I don't know why we can't. But I think it's time to start asking because, the checkbook's supposed to be public information.
Right. Carrie, there was a lot of stuff that was supposed to be under transparency. And every so often I'll go on the state's website and check that because actually you can look at the salaries and what break it down to pay period for ODM employees or any state employee and find out what they get paid or what they've been paid. And for a while that never worked. And I was sending them emails and through the state website saying, hey, your site doesn't work. I'm following these directions on here and it's not breaking it down. It's not doing anything. It would not take you to that to where you could even search or click on and then go through the thing and see what everybody makes. But it's amazing what some of them people make for the work they do.
Okay. Sunshine, yes, I seen that. Got it. I see that comment. So we should, unless you guys have anything else, I know I'm about done. And honestly, I can only do so much and then I'm just emotionally spent.
I also want to say one more thing is just the fact that, the state Medicaid directors and developmental disabilities and aging, they know that the provider enrollment process is not accessible. And some of the advocacy groups I'm in, we have reached out to the Center for Medicare and Medicaid Services about the, just numerous ADA violations. And we've even reached out to Medicaid and all of them about, ADA violations in the legislative process. And I've sat in numerous stakeholder meetings and things. And Janemarie is part of some of the groups I'm a part of. But, so we've sat on all these groups and these people are aware of it. But there was this one that we were on in December, and Ohio Department of Medicaid and everything brought all their lawyers to the meeting because they were so scared that we were just going to do something legal or something. But they brought all their lawyers and they acted like they had no clue that their services and supports are not ADA accessible and the enrollment process and all this stuff. And it's just interesting because they that when you do get meetings with these leaders, they play dumb and they don't like, they act like they have no clue that they're not accessible, even though you've told them over and over again. And or
Defensive
their enrollment
medicine
process is a
101.
mess. Like you could send countless emails to your senators and your state representatives too, and nobody really wants to deal with it. So I encourage people to keep writing their senators and everything. But
I'd like to do it publicly. I would like to do it as publicly as possible because I'm a very transparent, Chip and I made that decision whenever he was diagnosed that, we would be as transparent, and we knew it would open us up to things. And fortunately for us, that hasn't happened. But, social media can be kind of stinky sometimes, but we haven't had that. But I'd like to do that extremely publicly so that way that they can see, like, we see you. Do you see us? Because it is enough. It's absolutely enough. We're told right now that our ERs and our hospitals are overrun. There's no more room at the end. However, we have Amanda that, was unable to come on this evening. Her 3-year-old. So, 3-year-olds are always moving and pulling on things, and that's just what they do. And he has a Mickey button, which is how he gets his nutrition through his belly. And they have been unable to send her the Mickey button. So if he were to do what 3-year-olds do and they pull it out, he has to go to the ER to have it placed again, which would mean he'd have to have a pediatric surgical team because, there's only so much time before they can put it in. Well, he has CF, which is cystic fibrosis. So what do you think happens when you take a CF kid to an environment with a bunch of cooties and things? What do you think? Do you think that they're going to get sick?
Yep.
They have a higher probability of getting sick at the ER or in the hospital and testing positive. And now they're hospitalization when they just came to get a stinking Mickey button that you never sent them to begin with because you said you couldn't find them anywhere in Ohio. You mean to tell me the whole state of Ohio, there's not one Mickey button in this whole state? Then you find it. You find it. So we have a lot of that stuff going on that's really skewing this and contributing to these numbers and just everything that we see as a whole. And we've forgotten, like you guys have said, there's a difference between existing and there is a difference between living. And when your attempt, which was a piss poor attempt, Governor Mike DeWine, to protect the most vulnerable, results in them being injured physically, emotionally, socially, or psychologically, you did not succeed.
Mm-mm.
That's really all I have to say.
And that's a great place to end as well. I mean, there's really not much more to say. Where it's just
I would like to thank you, Catherine. Yeah, thank you, because I know that this is not typically what you do. Not that you're not interested, but this is not what this platform is. But as I explained to them, you have such a following of good. I mean, I've been on the receiving end of it, of good, wonderful followers that are loud, and they will stand with you, and they will make a point of that. That I really thought that this was a good place because they see these numbers and they hear these things. Now they have the ability to put a face with it. No, it's just not Carrie. It's not her family. My heart breaks for both Janemarie and Alicia. It's just the way it is. So thank you for taking time away from what your normally scheduled programming to let us
my normally scheduled programming. You are, I mean, this is important stuff. And I mean, it is, we're watching $500 million vanish into this pot that is supposed to be for you. And yet we've got nearly 50,000 Ohioans who are not getting any services.
Right.
And that's they're lying to us even more. They're telling us that you are okay and that we need to pay attention to, masking school children and the 4 tests per family per week forever.
But don't you worry about that 5 million.
Yeah. And it's just there's so much going on. They're using COVID to steal money and abuse vulnerable women.
Yeah, Shannon, I seen your comment. She said, "Can we share this video with what legislators?" Yes,
Please.
please.
I will be putting this up on YouTube shortly, so long as YouTube doesn't take down any of my other videos, because I was prevented from uploading my videos because they took down one of my videos with Jason Hedges from a couple weeks ago. So
Can
then
you
they
also share it
my
on
ability.
MeWe? Can you share it on
I'm
MeWe?
sorry.
Can you share it on MeWe?
Yes,
I don't know how to do that. So, but
I will figure it out.
Because I know Janemarie, I know it's hard for both of you. You know, here Alicia's been sitting in the chair for this amount of time, and I know what it's like to be on Janemarie's end of it, because you just don't know when there's a lot of care involved. So I appreciate you guys also coming and sharing. And I know it's
I was
hard
going
to
to say
be
that I
vulnerable.
have created some postcards that have my artwork that I made on the caregiver crisis that people can send to senators if anyone is interested to, and state leaders.
Thank you. If you can send me a link to that, I will also put it up on both platforms of mine.
Okay, cool. Yeah, I'm just trying to help get the word out because I painted 9 feet of art about the caregiver crisis, interviewed people all over the state.
Well, thank you very, very much. And to everybody that watched this evening, knowing that it wasn't going to be the traditional, here's your data, this is why it sucks so bad. I appreciate you guys sticking around very much. All right. And I don't do feathers, so I'm out. You guys have a good night. See you later.
All right, everyone. Thank you, everyone,
Thank
for
you.
joining us, and we'll see you next time. Good night, everyone.
Bye.